Hi guys, welcome back to the channel. So here there is another important. Hi guys, welcome back to my channel. So here there is another important question in counterfeit medicine. So yeah, so this is also an important university exam for PSM third year MBBS. So what are counterfeit medicines? Counterfeit medicines are nothing but they are a drug or medicine counterfeit that is produced with an intention to cheat. So counterfeit is a drug or medicine that is produced in intention to cheat according to WHO. What and all it can have? It can have mislabeling, no active ingredients or false labeling, wrong ingredient. So mislabeling, no active ingredients, wrong ingredients, or the ingredient that is in a correct ingredient but it is an insufficient quantity. Both branded and generic products can be counterfeit. Okay, so what are the things that are promoting or encouraging counterfeit drugs are lack of appropriate drug legislation, absence or weak drug regulatory system. So lack of appropriate drug legislation, absence of weak drug regulatory system, weak enforcements and penal sanctions, demand exceeding the supply. So demand is more, the supply is less. That time counterfeit drugs will come into action. High price of the medicine. So there is high price of the medicines. The difference is high. So obviously incentives will be given more for the counterfeit drugs, right? And insufficient cooperation between stakeholders. So stakeholders, there is insufficient or no proper cooperation between them. Lack of regulation by exporting countries within free trade zone. So there are free trade zone, so there is lack of regulation by the countries that are exporting it. So lack of regulation by the exporting countries in free trade zones. And in online pharmacies, illegal and unethical pharmacies, the counterfeit drugs can also happen. So what are counterfeit medicine? They are the medicine or drugs that counterfeit. It is produced with an intention to cheat. They'll have mislabeling, no active ingredient, wrong ingredient, ingredient in insufficient quantity. Both branded and generic products can be counterfeit. Factors encouraging counterfeit drugs are these: lack of appropriate drug legislation, absence or weak drug regulatory system, weak enforcement and penal sanctions, demand exceeding supply, high price of medicines, difference between them, and insufficient cooperation between stakeholders, lack of regulation between exporting countries within free trade zones and online farming.